everyone, and welcome to today's COVID 19 Planning and Response Office Hours. My name is Natalie Matthews, and I'm going to give a very brief welcome and logistics overview, and then we'll hand things over to our team of experts today. So, very briefly, I just want to affirm a few things. One is that all participants are muted and will remain muted for the duration of our time together today. You do still, though, have two ways to connect with us during our office hours. They are as follows. You can ask a question through the Q&A box, or you can submit a more informal chat message to connect either with the presenters or with other participants that you may see on the webinar. In terms of accessing both the chat and the Q&A, we ask you to take a look at your screen right now, and you should see, if you move your mouse around on the screen, you should see a chat bubble kind of in the center right of your screen. If you go ahead and click on that, it will open up the chat for you. And then to the right of that, you should see three dots, and those ellipses will open up the question and answers for you as well. If you submit a question to us today and we're unable to answer your question for any reason, we do encourage you to please ask your question after the webinar through the HUD Exchange Ask a Question desk, and the team will be sure to get back to you that way. And as a quick reminder, the session today is being recorded. That recording, along with our slides, will be posted to the HUD Exchange within a few business days after our session today. With that, I'm going to turn things over to Norm Suchar to get us going today. Norm?
Thank you very much, Natalie. So as Natalie mentioned, there are a couple different ways to communicate. One is to directly ask questions through the Q&A box. The other one is through the chat window. And one thing I want to strongly encourage is if you post questions in the chat box and it's something that your community is experiencing and dealing with, if you want to add some responses or add some context, that it's really helpful. This isn't just a one-way communication. We want to have an opportunity for you all to talk to each other about what you're seeing and different ways that you're solving problems. So also, if you hear a question come up and you know the answer or you have some information that you think would be helpful, please share it in the chat window. We have found that the chat window responses and discussion have been extremely, extremely helpful. So thank you very much for that. So I want to quickly introduce our panelists today. So I'm Norm Suchar. I'm from the Office of Special Needs Assistance Programs, the SNAPS office. We will also have Marlisa Grogan from the SNAPS office presenting today. Barbara DiPietro from the National Healthcare for the Homeless Council will be giving a quick update. And we'll hear an update from Emily Masaitis from CDC a little later on. We'll get an update from VA and an update from Seattle as well. So we have several other experts. They'll introduce themselves in the chat window, but we have several other experts, technical assistance providers, people from VA, from CDC, from HUD, and other experts on the phone. So you'll be hearing from a lot of us. So again, please put your questions in the chat window or in the Q&A box, and we'll just go ahead and get going. So the first thing I want to do, I'm going to turn things over to Emily from Centers for Disease Control and Prevention to do an update on CDC information. So Emily?
Thanks so much. Yes, this is Emily Masaitis. I am an epidemiologist working on the coronavirus response at CDC, specifically for people experiencing homelessness. So first, I want to thank you all so much as you take these critical steps to protect your clients and your staff at this time. There are so many difficult decisions that have to be made, and everyone's facing a lot of stress right now. So thank you all, and we want to support you as best we can. So many of you know about our guidance that we have posted for homeless shelters. We're also developing other guidance and communication materials that we hope to be posted and out soon. But I do want to give you a brief update on the posted guidance. So in that, there was an inaccurate statement about the recommended distance between beds for people that did not or do not have respiratory symptoms. So this is basically your general shelter population that you don't think is sick. We're fixing that error to say that beds are meant to be 3 feet apart. When people do have symptoms, like a fever and a cough, we ideally want them to stay in individual rooms if possible, but if that's not an option, then we want that area, in that area, the beds should be 6 feet apart. So I wanted to give that clarification, and if it's not currently saying that as I speak, it will be saying that on the website very soon. So keep an eye out for that, and again, apologize for that mistake. We are getting it up as quickly as possible. And I also want to say, unfortunately, I have to jump off in right before 3 o'clock, but we are very lucky to have Dr. Sapna Morris on to answer any questions that you have from the CDC perspective.
Great, thank you very much, Emily. And I also wanted to give a quick chance for an update from Barbara DiPietro from the National Healthcare for the Homeless Council. Barbara, I know that you guys are producing a lot of resources, healthcare resources related to homelessness and coronavirus. Do you want to give a quick update about the resources you have and that are coming out?
Sure, absolutely. Are you able to hear me okay?
Yes, very well.
Okay, good. Yeah, I just wanted to let folks know that we are trying to correlate a lot of the information that CDC and HUD and local jurisdictions are putting together on a dedicated COVID-19 webpage at our website. And so if you just go to our homepage, you'll be able to access it right off there. I also wanted to call attention to an issue brief that we just published that it outlines why homeless populations are a high-risk population for COVID-19 and why they should be established as priority populations from a local response. And then we also outlined some of the changes and the partnerships and things that are needed to really be able to stop the spread of the virus in this population. And so really urge you to check that out. It's just one page. Third thing is we will be starting weekly conversations on Fridays at the Healthcare for the Homeless Council, and these are going to be forums that are more healthcare related, but if folks are interested in hearing more from that space, we're really excited to start launching those, so look for more information. And then finally, we just prior to coming on to this discussion, we finished a webinar again, just looking at how COVID-19 and the healthcare for the homeless space and what people are doing. And so not only did we have some of the same folks that you're hearing from here from the CDC and HUD talking about what they've got going on, but also we got a chance to hear from the Healthcare for the Homeless folks in Atlanta and in Boston talking about how their programs are responding, all of the new things that they're standing up, and the protocols and the guidance that they're putting in place. And so we'll have that posted to our website very shortly. And we just hope that, again, our page can be a clearinghouse for some things you might be looking for. So thanks to you, Norm, and for everyone on this call for your partnership and collaboration and for having me here today.
Great, Barbara. Thank you so much. So let's move forward a couple of slides, and I want to introduce Marlisa Grogan from the SNAPS office, and she's going to give an update on a lot of questions we're getting and recommendations regarding shelter capacity and some other issues. So Marlisa, take it away. We can't hear you right now. You might be muted. We're not hearing Marlisa. So I'm going to walk through some of these topics, and Marlisa will jump on when she gets her sound back. So looking at we're getting a lot of questions about shelter capacity, and so we wanted to give some information about some of the things we're seeing. And we know that coronavirus has hit very hard in some places, but it's just sort of getting going in other places. So a lot of this is really to help communities prepare for what might be to come. One topic is it's important to identify a screening process. We actually have a screening tool that we have put up on our resource page. That resource page will come up in one of the later slides. But having a very simple and basic screening tool is incredibly helpful. You should keep checking back because CDC and HUD are continually putting up more tools and things like that that might be helpful. One of the things we have heard from communities that have really sort of where the coronavirus has hit very hard is the need to identify different kinds of shelter spaces. So identifying places for isolation is really important. So if you're operating a shelter right now or you are working with shelter programs, it's really important to start thinking as soon as possible about if you see somebody with symptoms and it's not somebody who's going to the hospital, what are your options and what can you find spaces where you can isolate people? And that could mean a lot of different things. It could mean, using sort of caseworker rooms if you have something like that. It might mean looking for motels or other kinds of spaces like that. It might mean putting up curtains or cubicle dividers or just, things like that to create some isolation for people that are showing symptoms. It's really important to work with your community to identify additional space. This is something we've seen time and time again, is that however much space you think you have, you probably need much more, partly because as you implement guidelines around space and separation, that will reduce your capacity somewhat, but also there are just going to be a lot of needs for isolated spaces and shelter spaces that can take people who have symptoms or who have tested positive for the virus. So work now with your community to identify those additional spaces. Unused buildings, motels are something that a lot of people are using. If you can get access to trailers, that's another option, but look at all the options you might have there. And then you really should be thinking about staffing. One thing we've seen is that a lot of shelters are losing staff either to illness or other things. And so you'll have to assume your staff capacity will go down. So it's important to think about other options that you might have, other places to get volunteers if you rely a lot on volunteers, other places to find professional staff. So really working with your community on how you identify additional people to help out in those cases is really important. It's really, the earlier you can look at your supplies and what you're going to need to have on hand for the next several weeks and to stock up as much as you can, or if you can't stock up, to at least start working with other members of the community to identify, who may have supplies that you can take advantage of. What is your supply chain going to look like? It's important to start that process as early as possible. Let's move to the next slide here.
Norm, I think if you can hear me.
Yep, perfect. So Marlisa,
okay,
why don't you take it from here?
Okay, so we've run into a number of scenarios that are now pretty familiar among communities, and we wanted to share them with you so that if they apply to you, we can share some ideas of what other communities are doing. So if your shelter becomes full as a result of social distancing, the social distancing that Emily just described, create a plan in coordination with your continuum and public health department and try to identify sites for general overflow capacity if needed. Facilitate a protocol for how to redirect clients when there's no space in your shelter. So ideally, you'd want to have this planned out ahead of time, but many of you are going to start implementing this step now as it's happening. CDC and local public health partners have recommended screening participants for COVID-19 symptoms. That's not testing, but it's looking for symptoms among people presenting at your shelter and adjusting shelter operations to serve both groups, both people who are exhibiting symptoms and not. If you're not able to screen people entering the shelter, then you should follow guidance for distancing and infection control. So this is another area where it's really important to be in communication with your public health department and healthcare facilities to identify if people in the shelter test positive for COVID-19. Next slide, please. If your shelter has been identified as a location it's not really equipped, or it's not a good place to support people with any kind of respiratory symptoms such as a cough or a fever, then you should communicate with your COC and public health department, even if you're not sure if you think that your shelter is one of those places where it's not the best place to support people in those conditions. Work with your COC and public health department to identify where those program participants with respiratory symptoms can go. And this is, I know it's the tough part, but facilitate a plan for how to redirect those clients as safely as possible. And that is going to involve working through, transportation questions, which is not the easiest, but a necessary planning step. And then if your shelter is not able to support people who are confirmed to test positive for COVID-19, then your shelter might be in the situation where you're not able to appropriately isolate a person with that positive test result. So if you believe your shelter is in one of those locations, again, communicate with your COC and be in contact with your public health department to know what to do, how to identify those program participants that have tested positive or are awaiting test results, and where they're going to go in either case, either if they have received a positive COVID-19 test result or if they're awaiting those results. And I'm going to turn it back to you, Norm, for information on encampments.
Great, thank you. So one of the questions we've been getting is about encampments, and should we be hurrying to move people out of encampments and into shelters, or dispersing encampments? Right now, we are recommending that people do not do encampment sweeps or start dispersing encampments. It makes it much harder for symptomatic people to follow up and get care. It probably increases the risk of spreading infection in a lot of ways, and shelter capacity currently is severely strained. So obviously work with your public health department, because they may have a lot more insight into sort of what your local conditions are and the options for everyone. But we are recommending that people look at implementing distancing within encampment areas, and making sure you have hygiene supplies and equipment available, hand washing stations, those kinds of things. But we have seen a lot of people that are asking about encampments, and we really urge caution before trying to do anything like doing encampment sweeps or those kinds of things. So please be careful, and right now we are encouraging you to try to work with the encampments as they are and implement safety protocols within the encampments. So let's take a look at the next slide, please. So it's obviously talked about this, but I also want to encourage people to look at working with people in encampments on identifying who has symptoms, and educating encampment residents about COVID-19, what they should be looking for, and where they can get resources or help when they need to. And as always, partnership is really important here. Please work with your public health departments. I know they're strained also, but as much as you can, try to partner with them. If you have a Healthcare for the Homeless program, definitely try to work with them and other partners in your community. Let's go to the next slide, please. I'm going to turn things over to Abby Miller from the SNAP's office. She's going to give an update, quick update about HMIS. Abby?
Yeah, thanks, Norm. Can you hear me?
Yep.
Okay, great. So it's very brief at this moment, but the main thing that I want to note is that we are going to have a package of HMIS guidance and workflow setup out by the end of the day today. Some communities are using HMIS to assist with screening and tracking, and what we want is for that to be a helpful exercise and not one that gets in the way of swift movement. So we are working on workflow setups that just sort of take the guesswork out of it and don't give folks too much to do, just collecting the information that you need to. So when we post that, it will go up on the COVID resource page, and also we'll put it out on the system administrator and vendor hubs so that everybody who's HMIS related will get it. Turn it back to you, Norm. Oh, but we can't hear you.
So we'll try this off mute. Thank you, Abby. So we wanted to give you an update from the SNAPS office. We've been getting a lot of questions about what is SNAPS's expectations for grantees and COCs around things like H2S inspections, around APRs, around governance, around all the things that are related to running a continuum of care program or governing a continuum of care. So obviously, everyone's number one priority right now should be responding to COVID-19 and taking all the steps you need to do that. We understand that this may hurt your performance. It may mean that you don't have time for things like subrecipient monitoring and governance. That's fine. We are looking at all this stuff. We don't know exactly how we're going to take all of this into account in future COC competitions and things like that, but we are definitely going to, figure out how not to penalize people for prioritizing, your COVID-19 response. One of the questions we've got, for example, is about governance. Should our COC be meeting? Should we be thinking about how to prepare for the next COC competition? And the answer, I think, is no. I mean, you should really be focused on COVID-19. If that means your COC is not meeting and not, doing the things your COC regularly does for several months while you're responding to COVID-19, that is fine. We are not going to be going around looking for people out of compliance for COC rules. So we really encourage you to just step away from some of those things and work on your COVID-19 response. And again, I don't know exactly how all of this is going to play out. We don't know exactly how long all this will last, and we're trying to figure it out at the same time you are. But we completely understand the situation and really want to make sure you're prioritizing, the important work here. At the same time, we are working on a set of waivers that for things like HQS inspections and things like that. But we have gotten a lot of questions about HQS, and unless your public health department says that it's okay to be doing things like HQS inspections, we understand that you are not going to be doing, the annual HQS recertification, and that, if it's possible to do it through FaceTime or something like that, we'd encourage you to go ahead and try those things. But if that's not possible, that's fine. We will sort of officially have a waiver that will come out soon. But even for now, even before that waiver comes out, please prioritize your COVID-19 response and please follow the directions of your local public health agency. Let's turn it to the next slide, please. We've had a lot of questions about ESG and COC grants and what you can do, what you can pay for through those grants. We have put out a few publications. There are links here. You can also just link to them or you can get to these through our disaster resource page or our disease resource page that we'll show you a little later. But there are numerous things that you can pay for with ESG or COC funds that would be tremendously helpful. So we really encourage you to look at those documents. If you need to amend your grants to move money over, please touch base with your field office as quickly as possible. We're working on a streamlined process for getting all that stuff done. Let's turn to the next slide, please. I'm going to turn things back to Marlisa here, and she's going to talk a little bit about coordination with public health partners. Marlisa? And we can't hear you again, Marlisa. You may be on mute. All right, so I'll go through these slides, unless you have come on since then, Marlisa. No, I think she's dialing back in. So it is really, really important that, that you work with your public health partners to escalate requests for assistance. Shelters have a lot of needs for space, for supplies, for staffing, for all that. And people experiencing homelessness absolutely have to be included in the community's public health response. We have a document on the HUD Exchange related to the kinds of topics and questions you should be asking your public health agency about as they're developing their COVID-19 response. Be very specific about what you need, what supplies, how many isolation spaces you need, what do you have available, what kinds of healthcare resources. And if you don't know, that's okay to communicate that. You can work with your public health agency on developing some estimates of what you might need. And maybe, we'll hear from Seattle a little later, and Hedda can talk about some of the ways they did this. But try to quantify things as much as you can. And again, please take a look at that document about what kinds of topics you should be communicating with your public health agency about. Let's go to the next slide, please.
Norm, can you hear me?
Yep. I'm going to turn things over to you.
Everyone.
No worries.
Okay, so to continue on with the coordination that really is essential at the local level, direct your requests to local county public health. Think through the relationships that you have or may take advantage of to make these connections. You can think through Continuum of Care board members or other providers who may have relationships with at the county level. At the departments of public health will typically have different points of contact that can also help you. There are titles that we included right here where of DPH staff that are COC points of contact, and they are they're being successful in co-creating solutions at the local level, and those include infectious disease coordinator, director, epidemiologist, senior policy advisor. So those are some of the key titles that that can help when you're looking for the right person to speak with. Next slide, please. So when you direct requests, ensure that you're communicating with your emergency management agency. If your community is preparing spaces for community-based quarantine and your COC needs to be included, your COC does need to be included in those conversations. So reach out to your county emergency management agency, and your community should also be thinking about community-based quarantine. And if it has not begun those efforts, and again, this is not an issue specific for Continuum of Care providers or homeless assistance providers, but is also really important for people who are in congregate settings. Coordinate with your emergency management agency to get the ball rolling if you haven't already. As emergency management agencies and public health departments continue to get stretched, escalate those requests as you need to your state, and if your Continuum of Care needs any technical assistance to make those connections, don't hesitate to reach out to the AAQ as soon as possible. We're monitoring the question pool with the subject line health preparedness and response. So reach out to us that way. And after you all at the city and county level reach out to your state, then at that point they can go to FEMA to request assistance. So there are potentially different solutions for those who have symptoms of COVID-19 versus those who do, and whether or not FEMA would or would not get involved. And we're still at the federal level ironing out those relationships and those processes. So we will get guidance out with clear workflow information as soon as we can. Next slide, please. And this slide, again, is just to reiterate that if you need our help at all, if you have a question, if you're feeling like you're not at the table in some of these conversations with public health or with your emergency management officials, reach out to us and we can help facilitate those relationships. Next slide, please. I'm going to turn it back to Norm.
Thanks, Marlisa. And so we have a few resource slides. We're going to have these resource slides scrolling throughout the rest of the presentation. So here are some different resources that are on the HUD Exchange. We'd also encourage you, if you have specific questions, we have a team of people who are responding to the AAQs, so please go ahead and submit it into the AAQ. And if you don't know how to submit stuff into your AAQ, someone in your COC likely knows how to do that, but if not, if you go to the HUD Exchange, there is a box on the right side that has some different options for communicating with us, including asking a question. So anyway, we'll be scrolling through these slides, but I want to give a couple updates or give some of our partners an opportunity to give some updates. And I want to start with VA. Do we have our partners from VA on the line?
Hi, this is Dina Hushar. Can you hear me?
Yep, you sound great. You want to give us an update?
Yes. So first of all, I hope people are doing well. It's been very chaotic times for everybody. And regarding the VA, we're continuing to do what I believe everybody else is doing, which is gathering information and trying to best support people in our field. And by our field, I mean at VA, we have the structure of VA Central Office where we're at, and then we have regional spaces, and then we have local community where the facilities are. So we're continuing to provide support both up and down. What we have been doing concretely in the last couple of days is that we've created a dashboard for our frontline clinicians to be able to see on an electronic format which of the veterans in the population that we serve are more at risk for getting COVID-19 or having negative consequences for COVID-19. And these risk factors are based on the CDC's observations of which is risk factors. And so we're proactively reaching out to them along with reaching out to others who are not in this risk category. So this has been a great webinar. Thank you so much for all the education.
Great, thank you so much. I'm going to turn things over to Hedda McClendon from King County, Washington, and they've been doing just amazing work under some incredibly difficult circumstances. So Hedda, do you want to give us an update on how things are going?
Sure, happy to. Thanks, Norm, for the opportunity to participate. Hedda McClendon, my home organization is the Department of Community Human Services, and representing a group of fabulous people here in Seattle, King County that are all working really hard. The City of Seattle, Public Health Seattle, King County, our Healthcare for the Homeless Network, our Facilities Management Division, and King County Metro are all part of our efforts locally. And most importantly, the providers in our community that are really the experts here and doing amazing work with a population that is in crisis and traumatized on a good day, and in this environment even more so. So I cannot say enough to appreciate those folks that are doing the amazing work on the ground. In Seattle, King County, we are really continuing our efforts to slow the spread of COVID in our existing COC. I talked a fair bit last time on the webinar about our efforts to redistribute our shelters to get them in compliance. And the clarification we got earlier on this webinar is 3 feet for people that are in shelters that are healthy and 6 feet apart for people that are in shelters that are symptomatic. We are really working closely with the City of Seattle to continue those efforts here locally. We have had a couple of shelters that have had a surge in population, so we have continued to get creative around supporting those agencies to disperse and continue to provide quality services. We've used things like the King County Airport as a location and using various facilities, public facilities the city and county have access to that are no longer in daily use because staff are telecommuting. So I would encourage people to think creatively about what space they could use to disperse shelters. We're also working to make as many shelters as possible 24/7 that are not, to sort of reduce the push to day centers for meals and sort of help to also disperse day centers. We're also working to bring online more day centers. Here locally in Seattle, one of the biggest day centers is our public library that is no longer open. So we are working to open new locations for people. The other thing we're really doing is looking at our encampments and partnering closely with our experts that do outreach in the field. We, as I think Norm mentioned, really are trying to keep people living in encampments in place as much as possible. So we have a group really doing some targeted work with encampments, really getting enough supplies to people in encampments. One of the creative things that our outreach providers have come up with is creating a 2-page laminated sign. One is red that says, "Please check in on me." One is green that says, "I'm okay," and making them large, having a way for them to attach to tents. So one of the things as we go around to encampments and check in on people is we're going to offer this to them as a resource, and for outreach workers and health professionals that are going to be regularly checking in, they then have a way of knowing how somebody that is living in a tent is doing and if they need help or not without sort of interrupting everybody. The other thing we're really working with, again, the City of Seattle on doing is standing up portable sanitation and hygiene locations, porta potties, hand washing stations, and trash removal locations. We've identified 5 hotspots and have begun that effort this week. So what you're seeing is we began with shelters, now we're working on day centers and doing some intentional work with outreach and encampments to really continue to support our efforts to slow the spread and then also increase capacity as needed. Some of the other things we've done, and I got this great idea from our friends in San Francisco, is utilizing our facilities management access to cleaning contracts and very large cleaning organizations, and we've identified using our HMIS data some of the day centers that get the most seniors coming through them each day and have deployed cleaning to those agencies. Really because I think like other people are already experiencing or will soon, as your schools and restaurants start to close down, it is hard for staff to then come in to provide services at these critical locations. So as much as possible, when we do have staff that have the expertise and relationships with people experiencing homelessness, we want them to spend their time with the folks in their programs instead of cleaning. So we are bringing in some support to help with that aspect of it. Some of the other things we are doing to really move from providing guidance to implementation is having calls not only weekly for everybody, but having targeted calls to providers that do day centers or providers that do PSH or supportive housing with seniors or with groups that we know to be vulnerable. And these calls are really an opportunity to reiterate guidance specific to those populations. So, for example, talking about in-home isolation and how you do that for PSH programs, or problem solving if you are a housing program that is a SRO and you have shared bathrooms or a shared computer lab, sort of thinking through how to be thoughtful about the use of those spaces in buildings. These calls are also, as I've demonstrated, opportunities to problem solve, but also really lift up the best practices and the creative thinking and the expertise of our providers and sort of share that. So we've begun to strategically do those and have opportunities for really targeted problem solving conversation, because in a community with Seattle King County, when we have a provider call, it tends to be a lot of people and hard to sort of really get your questions answered. The other thing we've done is our Healthcare for the Homeless network has some capacity and nurses that are on site in these locations. So we have really armed them with the information they need to provide on-site TA and support around how to implement the guidance. For the programs that don't have the luxury of having some medical staff that are coming through or healthcare staff coming through, we are standing up what we're calling a FAST team. This is a field assistance and support and technical assistance team. It is nurses that really know the homeless arena and also environmental health professionals that we are specifically training on our guidance, and they're going to go around and actually be on site with agencies that we know to either need some support based on the baseline assessment we did, based on the population they serve, or because we know they are not part of the rotation of already receiving healthcare staff. And then these teams will really work in partnership, try as much as possible to have this be a learning opportunity with some staff at the agencies and really see how are you implementing the guidance? Where are there gaps in your implementation of it? Where can we lift up, again, some of the best practices? And then specifically for those agencies that we have pre-identified to be able to actually do some isolation of symptomatic households from the general population, we're providing some guidance about how to do that and how to do that well, and how to have dedicated staff working with folks that are symptomatic, how to have dedicated bathrooms, and how to think about food distribution in a different way if you're essentially operating two different types of shelters, or one shelter with two different populations or different needs in it. So the FAST team is something we are working on to continue our efforts to proactively engage with the existing system here in Seattle King County. The other thing we continue to do is stand up our isolation and what we're calling locally congregate assessment and recovery centers. The congregate assessment and recovery centers are really short-term emergency mass sheltering opportunities that are really designed to help relieve the pressure on our hospital systems here. And for people that are symptomatic and do not need to be taking up a hospital bed, we are creating those locations. We continue to slowly stand those up here locally and really to work on our pathways for people to get into these. I know we here in Seattle King County have gotten a lot of questions from other communities specifically about our isolation and quarantine locations. So early next week, we're actually going to do a webinar specifically on this with the federal partners. So I would just sort of encourage people to keep your eyes open to that opportunity, and we look forward to sharing in a lot more detail how we in Seattle King County are doing that and some of our early lessons learned around setting up and supporting people to utilize these isolation and congregate assessment and recovery centers. I think Katie's going to do me a favor and post a King County video we did so you could see one of the locations. And for those of you who follow the news, Rachel Maddow, actually gave us a shout out last night on her show about some of our more creative thinking here, King County. So hopefully Katie will help me out and post both of those videos for people that are interested to see. Specifically around setting up the pathway to these isolation and quarantine systems, we have really approached this at a system level. So we have worked with our local COVID call center. When you call the call center, there is actually an option specifically for people living homeless service providers, and supportive housing providers. When you press this option, there are then two branches of our call tree. One is actually for people. So if you are somebody living homeless or you are a provider that is really calling about somebody that is symptomatic or COVID positive, you press 1. You then immediately have a RN pick up the phone and triage the situation right there live on the phone with folks and with providers. If the person then really is at risk or does have COVID and that is confirmed by the nurse on the call center, they are then routed to our isolation and congregate assessment and recovery center locations, and the transportation support and on-site security, behavioral health, and healthcare teams are aware that people are coming. The other branch of the call center tree is really designed specifically for homeless service providers and supportive housing providers. We then have announcements reminding people where to go if they are asking clarifying questions about our guidance. We have put it all very intentionally on our local Healthcare for the Homelessness website, because as the CDC and local state Department of Health update guidance, we really didn't want people to have stagnant PDFs of that guidance. So we started just sharing links to our Healthcare for the Homeless website where we house everything. The other thing we have besides guidance is reminders of our regular check-in meetings and reminders to our twice a week, what we're really calling Q&A calls, where we have healthcare professionals, environmental health professionals available to answer very specific questions from providers. The third thing that people can tell us is if they are modifying their services, if they are closing, reducing hours, increasing hours, that's something we want to track at a system level. So we remind people how to do that, and also for shelters and day centers, how to access our centralized supplies and warehouse, which is active now for those programs. Some of the things that we are hearing back from day centers is really in Seattle, King County, we are really partnering closely with people with lived experience who are using these services and actively really washing their hands and engaging in some of the sanitation and hygiene practices, and really supporting some of the social distances. There's some amazing creative thinking going on by service providers about how to engage the people in their programs in this and to be part of it. So I really think and would suggest that you think through that and highlight some of those amazing efforts that are happening on the ground. The last thing I will talk a little bit about is we are also starting to think about, as businesses close and a lot of hourly jobs are, people are in hourly employment are losing their jobs locally. At a city county level, we are doing some work around evictions and having mandatoriums on evictions. The other thing we are really partnering with some of our philanthropic partners around is thinking through how do we deploy a resource really strategically that supports households to stay in their housing and be able to pay their rent or pay their bills, because the last thing we need is more people, an increase in our inflow to the homeless system when we know anybody living homeless is extremely at risk here. So those are some of the updates of our efforts in Seattle, King County, and a reminder that we are going to do an isolation, quarantine, or really a congregate assessment and recovery center webinar early next week to sort of support everybody in those efforts. Thanks, Norm.
Great, thank you. That was a great update, Hedda. Very much appreciated. Thank you so much. We will definitely be sending out more information about that webinar as it gets scheduled and as it gets everything gets organized. So please check back on the resource page that you've been seeing scrolling through here. And also, if you're not on our listservs, the HUD Exchange listservs, it's probably a good idea to get attached to those. One thing I want to mention is we're going to do Q&A for the rest of the webinar. I've noticed there's not much chat going on in the chat box, and I realize we may not have explained exactly how you access the chat box. So I apologize for that, but we'll do that right now. So if you look at your screen, somewhere down at the bottom under the slides, you have a series of sort of these round icons. There's a mute button. There are just a couple buttons there. There's one that looks like a sort of a message bubble, a chat bubble. If you click on that, then it will open up a chat box. If you have questions that you think it would be helpful for the entire audience to hear, it would be great if you could type those questions in that chat box, so that way as we're answering them, because we have a bunch of people on the call who are ready to answer chat questions. As people sort of see those, as you have those questions, go ahead and just put those in there, and then everyone will get to see the responses. So great, thank you for that. And I think we're just going to jump into questions here. And it looks like people are informing me that there are many chats going on in the chat box, and so maybe everyone else is doing that right except for me, which is it's good to hear that everyone's seeing all those. So great. With that, I want to get to some questions. The first thing I want to ask is just a general question, and I'm going to ask this of Marlisa first, but there may be others who want to jump in. And David, I know you've been doing work in a lot of communities. Maybe you have some thoughts about how to address this. But when you have public health departments who don't seem like they are being responsive or answering to the needs of people experiencing homelessness, like how do you elevate that issue? How do you really get public health departments who are already really stretched thin? How do you get them to engage? So Marlisa.
Can you hear me?
Yes, can totally hear you.
Yay! Third time's a charm. Yeah, we have heard from communities that are struggling with that, and they've gone through multiple channels, including looking, also contacting their emergency management officials. But I think that if you also contact local government officials, that can also, like county executives, that can also gain a lot of traction. And the more specific that you can be about just how vulnerable this population is and what a dire situation it is. I mean, I've heard a number of people equate emergency shelters to mini cruise ships. So sometimes it's like a challenge of communication. Just on the prior Healthcare for the Homeless webinar, one of the point that I stressed was sometimes local community healthcare providers can assist in bridging the gap and being a champion. They have the medical expertise a lot of the time to be able to impress upon folks just how much emergency shelters and encampments and other unsheltered situations need to be factored into the plan. So those are a couple of ways. And then I just want to reiterate again, sometimes if you submit an AAQ and then you get your federal partner involved, we may have connections, either we in the SNAP's office or other TA providers may be able to be really effective in facilitating those relationships. So those are a couple of ways that you could try to hammer home the importance of having continuums of care at the table, but I definitely open it up to others to contribute.
David, did you have some suggestions for us?
Sure, Norm. Thanks. I just, there's a lot of different ways to escalate things. I think Marlise is exactly right that urgency is helpful as public health has become aware of the impact of this event kind of throughout their systems. I think in general their bandwidth is fully occupied, and often, unfortunately, the assets in a community targeted towards individuals experiencing homelessness are not sufficient to the need. And I think sometimes as we shift posture from understanding the difference between a chronic kind of moment versus an acute emergency, we've seen some departments between their bandwidth being fully occupied elsewhere in the community and that default posture kind of needing some support to refocus their attention and understand that the comorbidities present in households experiencing homelessness really, regardless of age, but also especially with age, put them in a high-risk position. And so sometimes working with the director of public health or a senior leader to help make that connection. And then if that's not a successful strategy, that the local emergency management leader can also be a resource for folks as well if you're not seeing the prioritization that you think is the correct calibration of the resources. So those are a couple of approaches. And finally, of course, you can always reach out for technical assistance, as Norm and Marlisa mentioned, through the AAQ if you need help.
Great, thank you. We have a question about whether there's specific guidance or information for programs serving people with disabilities. And Sapna, I wonder if you have any suggestions. Sapna Morris is from the Centers for Disease Control and Prevention. If you have any suggestions or if you're aware of additional material for serving people with disabilities.
Hey, can you all hear me?
You're a little quiet.
Sorry, how about now?
Much better, much better.
Okay, excellent. I'm just checking to see if that guidance has been posted. I know that we've seen some documents coming through, but I will have to defer until I can get something to you, Norm, but I do promise that we'll send something out.
Great, definitely appreciate that. Thank you so much. Also, we've had a few people that have identified sort of resources that they're aware of that they think would be helpful. And again, encourage you to put that in the chat box. I'm sure others on the call would be tremendously interested in that. So thank you for that. We have several other questions here. We have let's see, we have a question about screening tools I think we managed to cover. I do believe, Sapna, can you talk about the state of screening tools? I believe we published one that is from Atlanta that they were using. Can you talk about sort of your recommendations about how people should think about screening tools and whether, what people should be using or what you all plan on publishing or what guidance you're giving people about sort of screening tools as people come into projects? And you may be on mute. We can't hear you, so maybe I'll turn that over to Marlisa. Marlisa, do you have some recommendations? Sounds like we don't have Marlisa either. I will say we do have some resources currently on the HUD Exchange, and we are always looking for more and better screening tools. And so as we get more, we will continue to update that resource page and share things with through our listserv. I will say we have started doing a daily listserv message that shows all existing and new resources that we have put on the HUD Exchange. So If you're not signed up for the listserv or you're not getting those messages, I think we sent the second one today, then please sign up on HUD Exchange and you can get access to those resources. So I want to ask Brett a question. We have a few grant-related questions. So one question is about a continuum of care funded project that has some funding left over as the project is ending. Can you talk about whether people can use, if they have leftover funds in their project, can they use them for helping with the COVID response? Brett?
Hi, can you all hear me?
I can hear you just great.
Great. So if you have leftover funds in your grant, it's about to expire and it's not renewing again, so it was one that wasn't renewed again, and then you can talk to your local HUD field office and they can execute a grant agreement extension and extend your grant out a few months to allow you to spend money on eligible costs. So right now, you wouldn't be able to spend them on something that isn't otherwise eligible, but you could use it to continue serving participants a little bit longer.
Great. We have some HQS questions about, we need one question I'll just read out. We need official guidance allowing us to refrain from doing non-emergency and non-life-threatening HQS inspections on programs that require HQS inspections. I will say that HUD is working on some waivers. They're working on waivers in the context of both the Housing Choice Voucher Program and other PIH programs from HUD, so the sort of the various mainstream public housing and voucher programs that come from HUD. We at the SNAPS office are also working on waivers related to ESG and COC. But as I mentioned before, on ESG and COC, we are not going to enforce any sort of missed inspections during this time. So please, again, prioritize COVID response and we know, and follow the recommendations of your health department. And as those recommendations say, don't do in-person HQS inspections, please follow their advice. So we have a question about supplies and what resources are there for purchasing equipment like gloves, infrared thermometers, et cetera. So I just want to ask our colleagues from CDC or anybody else who wants to jump in here about what are the options for people to get supplies right now? Clearly, there's not sort of like a clearinghouse where they can get supplies. So what do you recommend for people who are trying to stock up and get supplies? Sapna, if you want to take a first shot at that question.
Yeah, sure. So in the last few days, things have definitely changed. And what I would say is the guidance that we've seen is that the Assistant Secretary of Health's office has, the Preparedness and Response Group, and we call them ASPR, ASPR, and they are a federal group that manages our stockpile. And because of the declaration of the national emergency and everything that's going on, we have to work through our state authorities, but we can push that request up and let people know. And I think we need to be very vocal about our need for supplies, whether that be PPE or testing supplies. And so that's incredibly important so that our service providers are not kind of, not counted when, looking at what's needed. And so I would say that you'd have to really push your counties or even go directly to state departments of health and state authorities to kind of find out what the process is for requesting those things. I know that ASPR is already getting requests, and even earlier today I saw a request for testing supplies, and that question was posed within our work groups over here, and that was the response, was that this is kind of ASPR's purview.
Great, thank you. And so people probably aren't going to call ASPR directly, hopefully. I think your advice is really good about getting these needs elevated through your public health department. I think one of the ways these supply shortages get addressed is when there's a request from a state to the federal government, and so it's really important that these requests sort of roll up to your state emergency management or whoever in your state is taking the lead on those things. So I just want to very much reiterate your recommendations there and how important that is. And it's frustrating when you can't get those needs met in the short term, but at the least, if you get those requests in now, there's some hope to get some of these things addressed in the next couple of weeks. And I also think if you're not as affected by the COVID spread yet, that it is certainly better to be doing all this work in advance before you're sort of under all that pressure. So great suggestions there. Thank you. So let's see what other questions we have here. So Brad, I wonder if you could help. We have a couple other questions related to grants, COC grants. So one question is about the flexible use of funds. Are COC grants permitted to sort of move money around in their grants without amendments, et cetera? Can you talk about sort of when people should be seeking a grant amendment from their field office and when they just have latitude and what that latitude is for changing what they spend their grant money on?
Sure. So in general, let's say you already have a supportive service budget line item and you're just sort of changing what you are spending your supportive service dollars on, then you wouldn't need a grant agreement amendment, but you would have to document in your case file that you're changing how you're spending that money so that when your field office comes out to monitor, eventually, not anytime soon, that they'll be able to see why it doesn't match what you submitted to us. If you're trying to create a new budget line item, or if you're moving more than 10% of money between budget line items, then you'll have to seek a grant agreement amendment from your field office. And we're working to make those happen as fast as we can because we realize time is of the essence here.
Great, thank you. And we've also had some questions about things like extending rapid rehousing beyond the 24-month period. Can you talk about when that would or wouldn't be allowed and how that would work?
Yeah, so I think you mentioned, Norm, earlier that we're looking at a series of waivers. That is one that we would have to allow through a waiver, so stay tuned.
And then we had a last question on this sort of line of questioning is somebody suggested that they'd heard that there was a moratorium on evictions from permanent supportive housing. Can you talk, so I hadn't heard that obviously, but can you talk about like what discretion grantees have with respect to not evicting people from permanent supportive housing and how COCs should be thinking about this?
Yeah, I also hadn't heard that for our programs. But if you own the building or you have, if you are the landlord or the sponsor, then you have a lot of discretion to sort of write your own policies and procedures for your grants, for your residents, for giving them a little bit more flexibility during this time to pay their rent, waiving late fees, giving them additional time to pay rent. If you're working with a private market landlord, then you're going to have to just have those conversations on a landlord by landlord basis. I don't know, Norm, or if David or anyone has any other suggestions.
I mean, I
think
I know
so
that.
I think go ahead, Brett.
Go ahead. No, I was going to say one other thing I would recommend is if your program participants are losing income, make sure you go ahead and reevaluate their income, and that would immediately lower the amount of rent that they have to pay if you're doing rent based on an income basis.
Yeah, I mean, obviously, I think the general rule here is that avoid evicting people when in any plausible scenario. And if you're concerned about, you feel like you have to evict someone for some reason, reach out to the AAQ, reach out to somebody in SNAPS, and we will help problem solve with you to find a way, hopefully, to prevent the need for that kind of eviction. Obviously, we're trying to keep people housed as much as possible.
This is David. I would just add to that. There's a logistical piece of executing evictions in this moment, that it is not a necessary function of government. And so to the extent that many folks on government have to be focused on a particular element of their roles right now, many sheriff's departments don't have the bandwidth to execute that function, or police departments. So that's a feature of this decision too at this moment.
Great, thank you. So we have a couple of questions about COC competition stuff. So we have a question about fiscal year 19 continuum of care grants and whether the execution is still proceeding on those. The answer is yes. We are working away at those. So field offices have started executing those grant agreements, and we will continue to execute those. I will say HUD is almost entirely teleworking at this point, but that we still have access to systems and such, and so we can still do that execution, and that includes putting funds in ELOCs and all this stuff. So we will certainly continue to do that. So if you have a question, you feel free to reach out to your field office. Understand that everyone's sort of trying to keep up with everything, so please be patient, but we are going to execute all the grants, and we will continue executing all of the grants. That includes renewal and new projects. We have a question about what HUD is going to do with the 2020 COC competition. And so I'll just be totally blunt about this. I have no idea. We are assessing everything day by day. Things are changing day by day, and so we don't know exactly what we're going to do. We will obviously keep everyone in the loop. I also know that several weeks back, it seems like forever ago, we put out a listserv message about a possible unsheltered homelessness NOFA. We are also looking at that and trying to figure out what makes sense in that context. So I don't have any news for you, but we certainly are sort of trying to track everything down and figure out, or not trying to track everything down, but trying to sort of think through all of the different things we have here and how can we ease the burden on you, and trying to figure out what legal options we have for doing this stuff. I will point out that we delayed some of the data collection requirements that we had. In case you didn't get the listserv message, we delayed the HIC and PIT submissions, housing inventory count and point-in-time count submissions until June 30th. You are welcome to submit them earlier. We certainly don't mind if you submit them earlier, but if you need the extra time, that's fine. We also delayed implementation of the coordinated entry data standards until October 1st. Again, you're welcome to implement them, but we completely understand how what the position that everyone's in and how we really need to be cognizant of the fact that you need to be prioritizing and spending all of your time on responding to COVID stuff. So again, we will continue to submit information and communicate through our listserv. So please keep in touch with those. So let's see, what other questions do we have? So I know there's a lot going on in the chat box, and to be honest, a lot of us that are on the call can't access the chat box. So please keep chatting, and if you happen to know the answers to questions, please go ahead and feel free to share information and examples that you have with other audience members. We do have a question I see about another question about HQS inspections. If HQS inspections are delayed, can agencies continue to provide rental assistance? You can continue to provide rental assistance. So it wasn't a trick answer where you delay, we were saying, don't do in-person inspections, but, you can still obviously continue to provide rental assistance. We have some questions about different shelter configurations and how to sort of address different shelter configurations, including some smaller shelters. We do have some shelters where, so we've sort of mostly talked about mass shelters and implementing distancing in sort of a mass shelter, sort of a barrack style shelter situation. But we also have a lot of sort of smaller shelters and family shelters that use, say, a house with several rooms or have sort of different configurations that are probably a little easier to do things like distancing and isolation. David, I wonder if you could talk about sort of how people should think about, because I'm sure you've seen some of these in California, but how people should think about when they have, say, a house or something that has a little more structure to it than just one open common space, and talk about, how you think about shared common areas, how you think about sharing bedrooms. And Sapna, I know you all are sort of thinking about this as well. So maybe, David, you could start, and Sapna, if you have some additional ideas, if you could jump in.
Sure. Thanks, Norm. That is the kind of shelter that I started working in when I first started in the field, so I'm familiar with it. And oftentimes, programs that operate in homes that are adapted to that purpose use the kitchen for its function and have guests who help to prepare meals, and many of those kind of less institutional elements of programs. We really worked pretty hard to incorporate elements of programs like that into the infectious disease toolkit that is focused on shelter operations around infectious disease. We looked at things like how to structure the rooms, the frequency of chores, to make sure that we were kind of doing a little bit more documentation around things to ensure consistency and sanitation practices and things like that. I'm not sure that's exactly where the question was focused, but I think folks will find that, my hope is folks will find that toolkit around shelter sanitation and practices helpful with that. Sapna, do you want to add to that?
Yes, and of course I was having 5 conversations.
It's a little hard to hear you. Oh, that's better.
Sorry, had to move the microphone back. And so we're just talking about shelter operations in family shelters in particular, or?
In some of our smaller programs that are maybe in an adapted house, Norm was referencing that, when you have bedrooms that are shared in that less institutional setting and a more home-like setting, are there features of that
Sure.
resonate with you? Yeah.
Yeah, so in some ways, like there's an ability to be able to have folks at least self-isolating a little bit better because they often do have rooms. But then you've got to consider the what we would refer to as household contacts, right? And what kind of really intimate contact people might have, all be in one room. So it can get complicated for a family, for example, that's in one room. On the other hand, in terms of the safety of the entire shelter, the idea that as you mentioned, David, the ones that I've worked in or been around, there's often, like you mentioned, communal eating, things like that. We would want to really try and distance folks so that maybe families would come down at different times, or you would want to separate some activities so that people could social distance still in that space, and have people as much as possible stay to their own room. but I realize that they may not be able to safely stay in that room if they were to test positive, for example. Now, we talked about this before. On one hand, I don't want to say that transmission isn't efficient in settings like in households, right? But I think if we are acting as if someone could be positive and we're very conscious, washing hands, cleaning things frequently, not touching your face, all of those things, we have seen that we can prevent even household transmission. That being said, like this bug doesn't necessarily jump room to room. It's not necessarily going in the air ducts. So you're not worried per se as long as, if people are staying within their room. But within the confines of their room, you might be worried about transmission and people being able to keep some distance there. So you really have to think about that. I hope the distinction there is clear.
Great. That's incredibly helpful. Thank you so much. We have a lot of questions about coordinated entry and how people should handle coordinated entry, both, potentially ramping when coordinated entry locations are closed or restricted in some ways, and how people should think about prioritization in coordinated entry. And so I'm going to open that up to the panelists here. I don't actually have a great answer for that. We certainly encourage the coordinated entry locations to stay open as much as possible. There are definitely things you can do to make it much safer. I think some of the things Sapna just talked about actually, and some of the guidance that's already out there are certainly very relevant in a coordinated entry scenario. But I wonder if anybody has additional thoughts about how should people change the way they're prioritizing for things like transitional housing, rapid rehousing, and permanent supportive housing? Should people be thinking about, for example, using transitional housing units, if they have them, for things like isolation and or people, or even quarantine? I don't know if anybody has any suggestions for how we should think about those resources. David, I'm going to sort of toss it over to you in case you have some thoughts, or Abby, I don't know if you've heard anything from some coordinated entry providers that might be helpful in this context.
I'm so sorry, Norma. I'm sitting in the Emergency Operations Center and I was distracted by something. Could you just give me that in a nutshell quickly?
Sure. You're probably distracted by the disaster that's going on. But so the question is about coordinated entry and about how should people be rethinking how they prioritize in coordinated entry. And one of the possibilities I sort of threw out there is if you have transitional housing units, should you be thinking about how you prioritize those for people who need isolation or possibly who need quarantine?
Yeah, thanks so much. So yes, there are folks are really trying to be very intentional and as strategic as they can in this moment where we also have to move quickly. And so I know that several states are looking to better understand kind of going back to the vulnerability and how highly vulnerable the folks that we work with are, and how to assign them to the housing resource that we can move fastest on. And in some communities, they've been making decisions like looking at hotel rooms at a kind of unprecedented scale to help limit the spread of the infection. And so I know that's not exactly probably where that was going, but the connection with coordinated entry is as we bring these new resources online, how do we line them up with the structures that offer utility? So not thinking about coordinated entry as a mandatory requirement, but more as a resource that we already have the interconnectedness of looking at eligibility and assigning housing resources and phone lines and reporting and lots of functions that help to serve the administrative component of this and let us deploy these resources much more quickly. And so I think as people come to better understand that the math around that, I think some folks are talking about like uninfected but highly vulnerable, potentially exposed, and the different populations, and reflecting back on that coordinated entry process. Sapna, I don't know if you've kind of heard or seen different examples of how people are looking at the individuals experiencing homelessness differently.
Thank you. Abby, I don't know if you had a sort of answer for David's last question there, or if you had any other thoughts to add here.
I do not, other than to reinforce what David's saying, that this is not about coordinated entry by the letter of the words on the page, but how it can be mobilized to create flow.
Yeah, I mean, again, I think that we completely understand that this is a different time, and if you deviate from your existing policy, around coordinated entry to help sort of address the challenges you're facing, we completely understand that and actually support and recommend that. So it's helpful if you just sort of like write a note about what you're doing for your file, so when we can sort of understand your thinking process there. But we really strongly encourage you to marshal all these resources and do what you can to help prevent the spread of disease and keep people experiencing homelessness as safe as possible. So we had a couple questions about we have places that have enforced sort of like shutdowns of all business and commercial and all kinds of activities, and some people questioning whether homeless shelters and outreach activities are included in these various sort of gubernatorial or other kinds of proclamations about shutting down all kinds of activity, and so I can't speak on behalf of every single state that has issued a proclamation, but my understanding is that shelters and outreach are almost always, if not always, being accepted from those kinds of proclamations, and that people should absolutely continue doing outreach work and doing emergency shelter work. In some cases, they're being classified as first responders, but whatever it is, certainly communicate with your public health officials about that, but it's something that we have generally seen is exempted from those kinds of things. So we're coming up to the end of our time. I do want to thank everybody for participating. I want to say we are going to be scheduling a regular weekly time for these sessions. We will figure out some of the chat functionality and how to improve that a little. But I want to just give thanks to everyone out there who's on the front lines doing this work. It is certainly one of the most trying times that we've had to face as a field and as a country, and just deeply appreciate all the work you're doing to protect people and keep people healthy. Definitely want to thank our panelists here from CDC and from HUD and our technical assistance providers, and from VA and from HHS and all the other partners who are working with us. Again, want to thank you tremendously for all the great work you're doing. Please keep checking back in with the resources. We will continue to post these resources. We will try to post the chat boxes and any of that information we can. So again, please just keep checking back with the page on HUD Exchange. And I want to wish everybody a wonderful rest of the day and rest of the weekend. And thank you very much for all the incredible work you're doing. And that concludes our session today. Thank you.